Welcome back. Today we are going to discuss something about how to become a registered pharmacist in Australia. To become a registered pharmacist in Australia, we need to follow certain steps and meet specific requirements. Here are an overview of the process. The first to be followed is educational qualification. Obtain a bachelor degree or master's pharmacy degree from a recognized university. Ensure that this program is approved by APC, means Australian Pharmacy Council. Before going into further details, first let us know something about what is an Australian Pharmacy Council, APC. The Australian Council, APC, is a national accreditation authority for pharmacy education and training. At the Australian Pharmacy Council, they focus on pharmacy education and standards. They are an independent body authorized by the Pharmacy Board of Australia, PharmBA, and the Australian Health Practitioner Regulation Agency, that is APRA. Ensure that the program you choose is recognized by the Pharmacy Board of Australia, PBA. The second one is internship. After completing your pharmacy degree, you must undertake a 1-year paid internship. This internship program provides the practical training and work experience in a pharmacy setting. You can apply for intern programs through various channels, including community pharmacies, hospitals, and other approved settings. The next step is national exam. Once you have completed your internship, you need to pass the Pharmacy Board of Australian Registration Examinations. This exam called the Australian Pharmacy Council exam, means APC exam. This APC exam evaluates your competence and knowledge as a pharmacist. Again, this is divided into two exams, that is CAOP exam and KAPS exam. CAOP examines competency assessment of overseas pharmacists. This is an exam to test the competence of foreign pharmacists, like from either the UK, Ireland, USA or Canada, who is looking to migrate to the Australia. The second exam is KAPS exam, that is Knowledge Assessment of Pharmaceutical Sciences exam. This tests your knowledge and understanding of pharmaceutical sciences. Now we have an Australian registered pharmacist. He will give you details about KAPS exam, the steps to be followed for attempting the KAPS exam, and the skill assessment structure, and content areas for the KAPS exam, and what is the exam format, and there will be two papers, paper 1 and paper 2, and the syllabus of the two papers, and next about fees, payments, and finally about how to check the KAPS exam results and everything. Here we go.
The Australian pharmacist journey. So becoming a pharmacist in Australia is not hard, as well as it's not that easy, but everyone can able to do it as long as they have passion and dream. So coming to to becoming Australian registered pharmacist in Australia, there is a it's an exam called KAPS, Knowledge Assessment of Pharmaceutical Sciences, which I'm just sharing the screen of everything. It's called KAPS, Knowledge Assessment of Pharmaceutical Sciences. You can see over here. That's the basic exam to get into the pharmacist, to work as a pharmacist in Australia. So as I'm just sharing the screen, I hope everyone can see it. So it was previously called a stage 1 exam conducting by the Australian Pharmacy Council. It is the exam for testing our knowledge, basic pharmaceutical knowledge, to work in industry or pharmacy, community pharmacy or hospital pharmacy in Australia. So for first thing, if you need to write the KAPS exam, the first basic step is to apply for a skill assessment, initial skill assessment from Australian Pharmacy Council. So coming to the initial skill assessment, um, whoever completed their like bachelor's of pharmacy, like 4 years of degree and PharmD, basically they're eligible to apply for the initial skill assessment. So the basic step is initial skill assessment. You have to have, as I said, the bachelor's of pharmacy or master degree or PharmD. Then you have to apply with all your documents like original transcripts, um, all of our. Sorry, I'm just seeing the chat as well. Yeah. Yes. Yeah. With all our documents, we have to apply for the initial skill assessment from the Australian Pharmacy Council. So if you Google APC, Australian Pharmacy Council KAPS, you will have, I will show you the slide as well, just in a second. Then you will know all the information regarding how to apply for the skill assessment. They will ask you all your original degree memos. They will check all the transcripts, your PCI registration from India and everything. Then they will give you a basic letter saying that, okay, you are eligible to write for the exam. So that's the first step. So once you get that confirmation letter from Australian Pharmacy Council, then you can able to book for a KAPS exam. Like the centers are in India as well now. I think in Bangalore, Hyderabad, yeah, a lot of places they're conducting KAPS exam. I think it's 3 times in a year. So as I shown you the screen here, so that's the skill assessment eligibility letter that needs from APC. Then you have to book for the exam. I think it's 3 times in a year at the moment. Like you will have in June, from my memory, they're conducting in June, um, October, and March, I think. So 3 times you will have that exam. I think it's for the skill assessment, I think it's around $1,200 to apply for the skill assessment. Then they will give you the positive skill assessment. Then you will write the exam. I think exam, it's per attempt, I think $2,200. Yeah. So once you book an exam, just I'll show you yeah, as I said, the qualification here is 4 years full-time academic study if completed before 2006, and 3 years full-time academic study if they completed before 2006. Yeah. So yeah, as I said, like you must also be registered pharmacist in the country where you're graduated. Is definitely the requirement for the APC, Australian Pharmacy Council. Otherwise, they won't be able to allow you to sit for the exam. So those are the basic steps. So skill assessment, apply for the exam, book for the exam. That's the first part of this KAPS journey. Yeah. So the process for requesting a skill assessment, so passing the eligibility check, passing the KAPS exam, and there is no eligibility for the, I mean, eligibility expiry. Once you apply for the skill assessment, you can have like any time, you can write the exam like any time in the life, no matter like it won't expire or anything. So once you check that you're eligible, like you have PCI, you have degree, everything, gather all your documents, apply for the eligibility check, uh, upload all the information as per the APC, and they will give you like 6 weeks to 8 weeks. They will get back to you regarding that you're eligible to sit for the exam. It's an online exam. It's a KAPS is an online exam. It's consists of 200 questions. It's a 2 hour exam with two, like paper one and paper two. So paper one consists of pharmaceutical chemistry, pharmacology, and paper two having pharmacy practice. Like it paper one basically having like organic chemistry, medicinal chemistry, analytical chemistry, and pharmacology in detail, like in depth. So as I said, it's not that hard. So it is consisting of like 200 tough questions, but it's not that hard. One can crack it like with a like 3 to 6 months of preparation, or like some people can have like in 1 to 3 months, depends on their capability. I'm not saying it's someone can do it in like 3 months, or someone cannot be able to do in 1 month. It depends on the capability and the individual as well. So the paper one, as I said, it consists of pharmaceutical chemistry, pathophysiology, and pharmacology. So they test you on, say, example, they will give you like a structures, um, SARs, and whatnot. Like it's a pharmaceutical chemistry is bit intense. Like basics are the main important for the chemistry, and pathophysiology, they consist of like anatomy, physiology, and pharmacology is in depth as well. All the dosages, it's different from India and here because they check all the dosages, interactions, side effects, basic concepts of pharmacology. They focus on a lot of drug interactions, and you will have case studies in paper one. It depends, like, but as I said, like you have to be thorough with the pharmacology as well, and that's paper one. And paper two consists of pharmaceutics and therapeutics. So it is pharmacology and pharmacokinetics. All the subjects are here, the bullet points: the pharmacology, pharmacokinetics, general physiology, medicinal and analytical pharmaceutics, biochemistry, and microbiology. It is all condensed. All the subjects related to toxicology, pathophysiology, microbiology, pharmaceutics, formulation and biopharmaceutics, therapeutical calculations. Yes, and calculations will be like 15 to 20 calculations. Depends on like the person as well, I think. Um, yeah. So sorry, I'm not able to get into chat, but I will definitely reply everyone's chat here. Sorry if you don't mind. Yeah. Um, yeah, and therapeutic calculations, like over-the-counter medications, clinical pharmacy and medications, all of those ones involved in paper two. Yeah, as I said before, for one person, it's $2,230 per attempt. Uh, it is quite like it. Once you pass the caps, once you come to Australia, this is like very easy for you. Like this doesn't matter when you come to Australia and do all your things. So it is easy exam, not that so hard compared to NAPLEX and PEBC. Because a lot of my friends and people I know, they have cleared caps in first attempt. So it's just a matter of like um, studying and gathering all the important resources. So yeah, and once you write the exam and everything is done, I think results will be available in your APC portal. It takes like 2 months, I think. They will give you the pass or fail. They won't give you any marks unless if you fail in paper one or paper two, they will give you like a stats of your uh, percentage. But otherwise, if you pass, its pass requirement is 50% in each section. Like in paper one, you need like in medicinal chemistry, analytical chemistry, all chemistry part, you need 50%, and pharmacology part, you need 50% in order to pass. And same with paper two, you need to have 50% of the pharmaceutics and 50% of the pharmacotherapeutics. So it's like each subsection, they will check your marks. And yeah. So yeah, you will get a skill assessment letter. Once you pass the exam, you will get a skill assessment letter, which means that you apply for like provisional registration as an intern pharmacist. You can work whoever in Australia pass the KAPS exam, they can apply for provisional registration straight away with APRA. It's a pharmacy board. APRA is a pharmacy board in Australia. Same like our PCI is APRA here. Um, yeah, you will have unlimited attempts to pass the KAPS. Uh, some countries have only, like New Zealand, for example, have 3 attempts. If you like only 3 attempts in the lifetime, but KAPS doesn't have any uh, threshold. You can pass, like you can write as many times you want. But as I said, it's not that hard at all. It's not impossible. Like it is possible with definitely good guidance and good resources. Um, yeah. And as I said, like as in the slide here, if you can see, if you pass paper one, you will have 2 years to pass the other paper. So if you, for example, if someone fails in paper one and passed in paper two, you will have 2 years of time to pass that paper. So that doesn't mean that you have to do two papers. Whichever you failed, you can write that paper. If you passed in that paper in the next attempt, then you're passed the whole paper. So yeah. So they will give you a skill assessment letter once you pass the exam. It is basically saying that you're eligible for applying as a pharmacist provisional in Australia, which means it is also used for your immigration. Yeah, the criteria is once you pass the CAPS, the next level is to apply for a visa. So here there is a criteria that you need, like once you pass the CAPS, you need 7 IELTS or PTE in each band, not less than 7, and you need overall 7 as well. So once you got English exam, you can apply for a invitation in Australia, like any, because nowadays there is a lot of demand for pharmacists or healthcare workers in Australia. So I heard like it is getting pretty easy. Once you have CAPS and English exam, you can apply for direct permanent residency, which is a 190 visa for some states in Australia, or 491 visa is a also a visa, permanent visa, but it's a temporary visa for now. Once you lived in regional area for 3 years, you'll get your PR. So 491 visa and 190 visa, those two are the only available visas once you have done CAPS English and you apply for your invitation, like for the visa. So these are the process. So I think like it's not 100% correct, but it's approximately around for one person you can have like $2,000 to $10,000. It depends on the application what you're applying for 190 visa or 491. Depends on one visa you're applying and depends on what state you're going. So that's the expenses, like an approximate expenses. It's not a accurate or 100% expenses. Depends. It varies where you're going as well. So the time required for the complete procedure, probably around, I will say, it again, it depends. So it depends, like, as I said, it's 24 weeks, but it can vary from 24 weeks, like around 6 months to 1 year, I will say. Also depending which process you're choosing and how eligible you are, whether you need a pharmacist position or need a permanent residency, it all depends. Like, but it's around 6 to 12 months for sure. All this process, once you clear CAPS, once you clear the English exam, once you apply for the visa, it is all like a streamlined process. So they are making it a bit faster, the Australian here. So yeah, as I said before, the exam dates here, as mentioned. So the registration period is from 21st February to 13th June 2023. So once you get your eligibility confirmation from the Australian Pharmacy Council, the skill assessment letter, apply for the exam. The exam dates are here. So in 2 rounds, like July and November this year, because the March one also already finished. So the exam dates are 17th to 19th July. They conduct like 3 days, 3 consecutive days for the KAPS exam, 17th, 18th, 19th, and that's 20, 21, 22 November. So yeah, so the registration period means you have to book for that exam. It only opens from 21 February to 13 June. So in that meanwhile, you have to book for the exam. Otherwise, you're gonna miss out if you are planning to write in that time frame. Okay. Uh, I hope I have covered all the areas. I think I may be sorry if I'm a bit fast, but yeah, please feel free to ask me any questions. Thank you.
I hope you got some useful information regarding KAPS exam and procedure. And final step is full registration. Upon successful completion of the internship and examinations, you need to eligible to apply for the full registration with the Pharmacy Board of Australia. Once you receive your full registration, you can legally practice as a pharmacist in Australia. It is important to note that the specific requirements and the process may vary between different states and territories in Australia. It is advisable to consult the Pharmacy Board of Australia and the relevant universities for detailed and up-to-date information regarding the pathway to become a pharmacist in your desired location. And finally, thank you and all the best. Aspiring to become an Australian pharmacist is a commendable goal. Best wishes to all the students pursuing a career in pharmacy in Australia. May your educational journey be filled with learning, growth and success. Remember to stay dedicated, work hard and maintain a passion for improving healthcare and serving the community with perseverance and determination. You can achieve your dream of becoming a registered pharmacist in Australia. Good luck on your path to rewarding a fulfilling career. Thank you.